Order. Senator Hanson.
Thank you very much, Mr President. My question is for the Minister representing the Minister for Health, Senator Cash. Minister, it's reported 78,442 people are infected with the coronavirus, of which 2,456 have died. Based on those figures, the mortality rate appears to be a little over 3.1%. In comparison to the Spanish flu, where the World Health Organization believed 2 to 3% of those infected died, the coronavirus appears to be a deadlier pandemic. While I commend the Morrison government on closing the borders to Chinese travellers for the past few weeks, I'm at pains to understand why Australian universities are able to put profits before the health security of this nation. Will the minister guarantee the health of Australians and put an end to universities circumventing our nation's flu-stopping Chinese travel ban?
The Minister representing the Minister for Health, Senator Cash.
Thank you, Mr President, and I thank Senator Hanson for the question. And Senator Hanson, I am going to have to reject the premise of your question. The government's advice is very, very clear. Students who have been outside mainland China for the last 14 days may be able to enter Australia, provided the student does not return to China on the way to Australia. The government is not actively suggesting that students travel to a third country for 14 days because of the changing epidemiology of this disease. The rapidly evolving situation, combined with changes to travel restrictions by other countries, could mean students could get stuck in a third country. Our advice to international students is that they should monitor the advice on the Department of Health and Department of Home Affairs websites. Students should also check with their airline and education providers before making decisions to travel to Australia, including via a third country. They should also check any current travel restrictions for other countries before travelling. I do acknowledge, Senator Hanson, that you have commended the government on the action that we have taken to date. And as the Minister for Health and the Prime Minister have stated, Australia is ready and our government is working constantly to keep Australians safe. Australia, as you have acknowledged, was one of the first countries in the world to declare coronavirus as a disease of pandemic potential on the 21st of January, and this was more than a week before the World Health Organization. In terms of the decisions that the Australian government takes, as I have reiterated to the Senate, these decisions are underpinned
Senator
by
Cash.
medical advice.
Senator Hanson, a supplementary question.
Thank you. Given the Royal Darwin Hospital cannot deal with coronavirus cases and patients are being sent back to their home states for treatment in capital cities, can the minister list for me the hospitals in regional Queensland that can treat the virus should it break out in my home state?
Senator Cash.
Thank you. And again, Senator Hanson, I'm going to have to reject the premise of your question. The decisions that the Australian government have taken are underpinned, as I've stated to the Senate on a number of occasions, by medical advice and recommendations from the Commonwealth's Chief Medical Officer and Chief Medical Officers from each state and territory on the steps necessary to contain the spread of the coronavirus. In terms of the advice from the Chief Medical Officer, the Chief Medical Officer has confirmed that our arrangements to protect Australians from coronavirus are working. There are no confirmed cases among Australian citizens and residents who have returned to Australia since the introduction of the border measures on the 1st of February 2020.
Senator Hanson, a final supplementary question.
There has been a lot of talk with regards to the containment of the coronavirus. Minister, are we past the point of containment of the coronavirus in Australia?
Senator Cash.
Thank you, Senator Hanson. And again, I'll refer to my previous answer. The Chief Medical Officer has confirmed that our arrangements to protect Australians from coronavirus are working. There are no confirmed cases among Australian citizens and residents who have returned to Australia since the introduction of the border measures on the 1st of February 2020. Our health experts have advised that the situation with coronavirus in mainland China has not improved in the past 2 weeks, and as such you would be aware that we continue to require Australian citizens, permanent residents and their families who have been in mainland China from the 1st of February 2020 and to return to Australia to self-isolate for 14 days from the time they left mainland China. But I would reiterate, our decisions are underpinned by medical advice and
Order.
recommendations
Senator
from the
Cash, time for the answer has expired. Senator McGrath.